This is return audio from WDIE Receive Control. Please stand by.
1 o'clock works for me. I'll make sure.
Hold on one second. Sorry, I'm just checking my computer. Sorry about that.
That's fantastic.
From
Thank you very much.
WDIE.
All right, good morning, everyone.
Please stand by.
I'm hearing a lot of noise, or there are individuals who are not muted. You could please mute yourselves if you're not. Okay, we're going to get started then. This is our COVID-19 response data and modeling update. We have with us today Dr. Sarah Line-Callow, who is the Director of the Bureau of Epidemiology and Population Health at the Michigan Department of Health and Human Services. And Sarah, I'm going to turn this over to you and let you share some information about COVID-19 data trends as we are seeing them in Michigan right now.
Good morning, everyone. Let's move to the first slide, please. Sorry, before I continue, I see there's a question about recording permission. This is being recorded, correct, Lynn?
Yes, I apologize. Yes, this is being recorded, so everybody should be aware of that. In addition, there is going to be some closed captioning, so that will be available after the presentation as well. So if you
Can we get recording enabled, please?
I'm checking with my other host, Annie. Okay.
Okay, so I'll go ahead and get started then.
Sounds great, thank you.
Okay, so good morning, everyone. And thank you very much for taking the time to listen to this presentation regarding our COVID-19 data update. Michigan has now recorded the 7th highest number of cases and the 4th highest number of deaths in terms of the states in the nation. For both of those indicators, we've declined 1 rank. We're now the 6th highest hospitalization rate as a percentage of total beds in comparing to other states, and we've moved up 1 rank there. In terms of our case rates, we have some cautious optimism here in that we are seeing our case rates declining. We're now down at 515 cases per million people per day. And when I look at some of the more recent data, we're still continuing to see that decline. Coronavirus-like illness complaints and diagnoses in the emergency department are also decreasing for, I think in this case, more than 2 weeks. Percent positivity, so the percent of all diagnostic tests that are positive, has plateaued over the past 3 weeks. I'm going to show you a little bit of detail on that data. We're continuing to monitor the available inpatient beds, and you're going to hear more detail about that in this presentation. Looking at the week of November 22nd to November 29th, we had 660 deaths occur in the state of Michigan related to COVID-19. This was an increase of 81 deaths over the prior week. Our daily diagnostic testing did decline over the holiday week. So we're at about 51,000 tests per day. It may be that we're seeing some recovery there, but it's very important that people are getting out and able to get tested for COVID-19. And then today's briefing I'm going to do real quick summary on some of information that we have regarding violent offenses in the state that's been recorded each month. So next slide, please. So first I want to give you some context where Michigan is in relation to other states. We have 33 states in the nation that have been seeing an increase over 2 weeks in their case trends. 48 states, which is up from 46 last week, have significant outbreaks. Looking at the Midwest region, you can see more detail about who's experiencing highest per capita hospitalized patients and things like that. But moving down to the bottom of the slide, they're looking at Midwest. Wisconsin is showing some decline in hospitalizations and cases. Indiana is now number 3 in the nation in terms of number of hospitalized individuals per capita for COVID-19. However, their case rates remain above 1,000 per million people. Illinois is showing a decline in hospitalizations. Their case rate is stable. Ohio has a slower growth in their hospitalizations, and their cases are relatively flat. And then Michigan, you're going to see that we have flat hospitalizations and declining cases as well. Moving on to the next slide. Going to go through some detail about where percent positivity is. It's a complex picture here, but getting some detail for you about what's going on in the regions of the state. As I mentioned before, testing has dropped since the Thanksgiving holiday. We're hoping that we're starting to see a recovery on that, but we really want to emphasize the importance of getting tested if you think you've been exposed to COVID-19 or if you have COVID-19-like symptoms. One of the reasons this is important is positivity. One of the things positivity indicates is whether or not we're testing enough to be able to identify all cases in the state. So when we see testing declining and positivity going up, that's a signal to us that we need to be testing more. Our cases are continuing to decline for the second straight week. We're seeing decreases among most age groups, race and ethnicity groups. However, we're continuing to have concerns about residents who are Black African American, Native American, and Hispanic Latinx. The increasing rate of deaths has slowed somewhat from previous weeks. In the past 30 days, nearly 10% of deaths in the state have occurred among those who are younger than age 60. And we're going to go through some data on race and ethnicity as well in terms of mortality. The next slide provides what we refer to as the postage stamp, is our nickname for this slide. It's giving you a look at the indicators for cases, testing, hospitalization, and mortality for all of the MERC regions. So a couple of things I'll highlight. If you look sort of the column that says CDC case trend, one of the things that's encouraging is that we're seeing a decline in case trend rate per day for all of the MERC regions. These data that we're looking at here are for case data are from November 30th. You can see as of November 30th, the absolute cases per million people as a 7-day average was declining for 17 days. Our percent positivity was at 14.4%. It ranged in the MERC regions from 9.8% in the Upper Peninsula, declining, to over 15% in Grand Rapids, Kalamazoo, Saginaw, and Jackson regions. You can also see our testing rates per million people there. We're at about 56,000 tests per million people on the testing data on this slide, which was from December 4th. And you can also see some of the information on trends in the emergency department and our death trends there as well. Next slide, please. So let's talk more in depth about testing. Next slide. So this is a graphic that is showing you the daily numbers of diagnostic tests and then what percentage of diagnostic tests come back positive. And this is based on the date that we receive the message about the laboratory test. So the most recent data on this graphic is showing us that including Michigan Department of Corrections facility, our percent positivity is about 14.3%. If we exclude Department of Corrections facilities, our positivity is closer to 14% here. Next slide, please. This is another view of that same kind of information. This is giving you the number of tests each day that are performed in the state of Michigan. So you can see that we've had a decline in the number of tests from around 1123 downward, and just the most recent couple of days, we're starting to see an increase in those numbers. Next slide, please. And this is a more detailed look at the percent positivity And this is the 7-day rolling average in percent positivity. So you can see we're at around 14% on November 15th. That's a 7-day average in positivity. We declined to about 13% on 11/23. Then we began increasing again, and we hit about 14.4% on December 5th. I just took a peek at the numbers that got to be updated last night, and the trend is starting to turn down again. So we may be in sort of an undulating plateau in terms of percent positivity here, but we'll continue to look at this data every day. Next slide, please. This is our test turnaround numbers. You can look at these in more detail in terms of by laboratory on our state website, michigan.gov/coronavirus. In the last 2 weeks, we had nearly 900,000 diagnostic tests reported to us. About 68% of those results came from commercial laboratories. We had overall in the state, it takes less than a day for a sample to go from the collection point to the laboratory where it is being analyzed. And our overall turnaround time from when a sample is collected all the way through to when the message gets through to public health is 2.9 days currently in the state. And we provided for you the preparedness region numbers for tests, total tests, transport time, as well as total turnaround time there. So you can see the regional variation. Next slide, please. This is comparing the state of Michigan to other states in the nation in terms of the numbers of daily tests each day, obviously the number of daily tests, as well as the percent of the population that is being tested in the state each week and the percent positivity. So these are numbers that are presented from the COVID tracking project, is one of the ways you can look at this. So the black bar is giving you the rank that we're in this week. And then I did go through and just highlight in red the rank that we were at the week prior. Next slide, please. We also want to provide you some detail on the percent of diagnostic tests that are positive by county. The smaller map is giving you the prior week's positivity, and then you can see the current week's positivity by county in the larger map. So 70 of 83 counties this week have percent positive tests that are in the double digits. This is over the past week. We've also given you the inset graphic there is giving you the positivity, number of counties in each positivity breakdown group there. So you can see the comparison between this week in the black bar and last week in the gray bar. Next slide, please. So now we're going to move on and talk about cases. This is this graphic here is giving you the number of cases we report out each day. So this is the number that comes out around 3 o'clock on the face of the michigan.gov/coronavirus website. A couple things to note. You can see that after having had an increase in the number of cases we're reporting each day, we're fairly flat. Not willing to call something a decline yet, but perhaps there's a hint of a decline there. In the last 7 days, we had more than 44,000 cases reported identified and reported out to you in the media. Next slide, please. This is looking at that same information, but looking at it by onset date for both confirmed and probable cases. So this is the date that when we conducted a case interview, somebody told us when they became ill. You can see the decline there in the number of cases by onset date. Just a reminder, there's a little gray bar that you see on both of those graphics. That data is unstable and incomplete at this point. So it's important not to put too much weight on data that you see within that gray bar. Our current daily test case rate remains more than 5 times the rate we're experiencing in early October. Next slide, please. These are those case rates for the age-specific groups in the state. You can see that all groups are experiencing either a plateau or a decline, which is a very encouraging sign that we're seeing that consistently across all groups. Next slide, please. This is giving you another look at the age-specific case rates. This is again by date of onset. and we're providing you the information for the last 2 weeks as well as cumulative. The call out, the circle call outs there at the bottom are giving you the percent of the age groups cumulative cases that occurred in the most recent week. And something that struck me is the similarity of those numbers across all those age groups there. Next slide, please. This is giving you case rates by racial and ethnic groups in the state. Most groups are experiencing a decline in case rates. We still have quite a bit of disparity in those case rates. I did want to highlight something that we're tracking very closely is the case rate on the upper left graphic for African American residents. I know I just told you to be hesitant about making interpretation on data within that gray bar, but one of the things I did notice is that the African American rate did increase there. So we're going to be watching that very closely. We want to make sure that all populations are experiencing, all populations are declining here. Next slide, please. So now we're going to talk about the outbreak data. This is available on our website every Monday. This is the data that is the local health departments report back to us about the number of outbreaks they are investigating each week. The orange portion of those bars is telling you how many ongoing outbreaks they are still working on. And the blue part of the bar is telling you the number of outbreaks that they just began investigating this week. The total number of active outbreaks, so the orange and blue, is up 9% from the previous week. We have more than 1,200 outbreaks that local health departments are working with right now. Following long-term care facilities and the manufacturing construction industries, the greatest number of new outbreaks, that blue bar, are reported in K through 12 schools, offices, childcare, healthcare, restaurants, and retail settings. Next slide, please. I know there was a request for information regarding the studies of restaurants. We want to, we've put the references in here, and we'll make sure that those links work when they go up in the PDF so you can follow through directly to the study. But we provided you some summaries of each of those studies there. Next slide, please. This is the same information on the number of outbreaks in the K through 12 settings that local health departments are aware of. In this case, the bars are describing the number of cases associated with those outbreaks that local health departments report back to us each Friday. Currently, local health departments are working with schools on responding to 230 outbreaks across the state. 9 of those in the K through 12 arena are among administrative only. We have 85 outbreaks that are associated with pre-K through elementary and 96 that are associated with high school. Just want to point out that the range in the case numbers, range of cases per outbreak for the younger age group still remains relatively small compared to that for the high school group. Next slide, please. So we're going to hit on some mortality data. The next slide is giving you the number of confirmed and probable deaths by their reported date. You can see the current, so death is a lagging indicator. When we see an increase in cases, it'll be a couple of weeks before we start to see that increase in death. So we have the same issue on the way down as well. But we do see that the rate of increase in mortality is starting to slow. The current number of deaths is 5 times the number of deaths that we were experiencing in early October. Next slide, please. This is giving you the, on the right-hand side, you're seeing the total number of confirmed and probable deaths by age group in the past 30 days. And on the left-hand side, you're seeing the age-specific rates. And you can see rates, the growth in those rates slowing, plateauing, or you may see a reduction, like for example, the 80 plus, we're starting to see a reduction in the mortality rate for that group. Next slide, please. This graphic here is giving you information on the daily case rates per million people by race and ethnicity. On the right-hand side of the graphic, it is giving you the percent of all cases that are made up of different groups here. So for example, the farthest right-hand bar on the upper graphic is giving you information that in the light gray bar, it's telling you that of the deaths that occurred in the last 2 weeks, 90% of those deaths occurred among white residents, whereas white residents make up about 80% of the total population in the state. It's just to give you a little bit of interpretation about how to read those numbers. Moving back to the left-hand side of the graphic, on the upper left, you can see this is the race or ethnicity specific mortality rate for each group. We do see that the lightest blue line is the rate for white individuals. And you can see that plateauing, that rate. The black line, which is most recently the highest mortality rate, represents deaths among American Indian, Alaska Native. We do see some decline there, but it was a very high peak. The cobalt blue line is providing mortality rate for African American residents. The bottom graphic on the left is providing the information for those who are Hispanic Latinx or those who are not Hispanic Latinx. Next slide, please. All right, moving into data regarding our healthcare capacity and how COVID-19 may be impacting it. Since September, complaints about coronavirus like illness in the emergency department have gone to 2% of all visits, or less than 2% of all emergency department visits, to at times more than 9%. However, in the last 2 weeks, we're seeing a decline in this number, and it's about 7% now. The utilization of hospitalizations and ICU is plateauing or decreasing, depending on where you are in the state. However, hospitalizations are near 90% of our spring high for COVID-19. 6 of the 8 regions in the state are seeing decreases in hospitalizations in the last week. The exceptions here being, these are preparedness regions, being Region 1 and Region 2 South. So let's go into the detail here. The next slide is data that you can look up on CDC COVID tracker. So you could look at this information for other states as well if you're interested. This is giving you the purple line right now. Well, it's the highest line that you see on the graphic, is giving you the percentage of emergency department visits where there's either a complaint of coronavirus-like symptoms or a diagnosis of coronavirus, COVID-19 in the emergency department. You can see that we had increased up to 10%, and now we're seeing a decline over the last couple weeks here. So that's a very encouraging sign. Next slide, please. These are data that are looking at the counts of people who are hospitalized who have been confirmed positive for COVID-19. You can see this week hospital volumes for COVID-19 were down about 4%, which is the first decline we had seen in hospitalization since September. We, however, still remain at about 90% of our spring peak. You can see that through that small inset graphic below. And our new COVID admissions, which is data not shown here, but the new COVID admissions also appear to be down this week compared to prior weeks. Next slide, please. This is a similar look at the number of people who are confirmed positive in the ICUs in the state. The census in the ICU for COVID has been flat to slightly decreasing over the past 2 weeks, and it's making up about 30% of adult ICU beds. Preparedness regions 2 South and 2 North showed growth in ICU hospitalizations week over week. However, these regions have been flat in the past few days, and you can see more detail there about ICU occupancy by each of the preparedness regions in that table. Next graphic, please. This next set of graphics is giving you the regional information regarding the number of confirmed positive, COVID positive individuals who are hospitalized in the state. Regions 1 and 2 South show positive growth week over week, but both regions, you can see that they're starting to flatten there. Other regions are showing a decreasing trend, and you can see more detail there about what the growth from last week is. Next slide, please. So we've got a couple of slides coming up about how our public health capacity is doing with this increase in cases and need for a response there. Our case investigation and contact tracing, we are maintaining steady levels. However, the percentage of all cases that we're actually able to investigate is low, given just the volume of cases that we're seeing. We did have some good news that you're going to see in a minute, that the percent of cases investigated has increased over last week. So we're starting to trend in a positive direction here. Next slide, please. So this is giving you information from the most current week and the week prior on the right. So on the left-hand side, we're looking at case reports that were referred out to local health departments for investigation, or the state investigation group, between 11/28 and the 4th of December. We have more than 46,000 cases that were referred out for investigation. We're able to complete investigations on 11,400 of those, which is about 25% of all the cases. We're working hard to bring that number up, both through implementation of some new technology that will enable people to begin their own case investigation form, but also bringing on more staff at the state and local level. So you can see that we were up to 25% of cases being investigated compared to 20% the week prior. So we're trending in the right direction, but we have a ways to go yet. Of those that we did complete a case investigation on, 43% of cases were able to identify a known source of infection, and 27, which is up a little bit from the prior week. However, 27% of cases reported that they were already quarantining by the time they developed symptoms. And this has been steady over time. This number, the higher this number is, the less likely it is that somebody who is a case of COVID-19 has infected somebody else in the community. So we'd like to see this number increase. Next slide, please. Just wanted to give another plug for one of the pieces of technology we're putting in place to make sure that people who have potentially been exposed to COVID-19 are aware. This is our My COVID Alert app. More than 450,000 people have already signed up for this app. You can use it on an iPhone or Android. And what it enables, it's very anonymous, very private. But if you do become a case of COVID-19 and you've used this application on your phone, public health will give you a PIN number, and you will be able to put that PIN number into your system and anonymously let people who also have this app know that they have potentially been exposed to COVID-19. So the application measures the distance between cell phones and the amount of time between cell phones. And if someone else is participating in this exposure notification app, you would get, if I had been near someone with COVID-19 who also had the app and they sent their notification out, I would receive a notification telling me, you know, you've been in close contact with somebody who is COVID-19 positive, and you want to monitor your symptoms, take action, that kind of thing. So it's a nice tool that people can use to help raise their situational awareness. Next slide, please. So we do have some information. I'm not going to go through each of these slides in the interest of time, but you can look at the detail here. These are data that are collected by Michigan State Police. They are information on the total number of offenses that were reported in the state of Michigan. So for this current month, total offenses are down 16% this year compared to last year. there's information here on the type of offenses. So you'll see when you go through the data in detail that aggravated assaults and murders are up this year compared to last year. Aggravated assaults are up about 9%, murders up about 20%. And you particularly see these increases spiking in the summer months. Non-aggravated assaults, reports of those had actually decreased 11% compared to prior year. Domestic violence offenses, reports of those had increased 9% compared to 2019. While overall motor vehicle crashes are down 22% from 2019, the number of crashes that had fatalities in them has actually increased by 2%. So those slides are available to you in the deck. If we can jump down to where we have mobility data, just going to leave one last piece of information for you. We are continuing to monitor mobility data. So this is looking at data from the Federal Bureau of Transportation Statistics. And the graphic on the top is giving you the proportion of people of the population that are estimated to be staying home by month. The green line is giving you 2020 figures. The gray line is giving you 2019. So you can see about 30% of people of the population of Michigan are, a little bit less than 30%, are staying home. And you can see that that level has increased recently. Stay-at-home levels, based on this data set, appear to have stayed high over the Thanksgiving holiday. Our most recent data in this graphic is from 11/29. So that's what I have to share today, and happy to answer questions. Thank you for your attention.
Thank you, Dr. Line-Callow. This is Lynn Sutphin, Public Information Officer here at Michigan Department of Health and Human Services. So we are going to offer some opportunities for some Q&A. So I'm going to start with Tim Skubik because you've probably had your hand up the longest. So go ahead, Tim.
Lynn, quickly, is there a way we can get video of the doctor on camera for us TV folks?
We did not plan to do video of our speakers today, but we'll definitely keep that in mind down the road. I can definitely get you a photo. I know that that would be much better for video. Sorry about that, Tim.
Okay, that's all right. No problem. We'll pretend we're just doing radio. Doc, I heard the word decrease and decline, I think, more than I heard increase. And apologies for trying to simplify this thing, but we have not turned the corner. But what are there more declines than there are increases on the numbers you're looking at?
I think in the executive summary, I was talking about having some cautious optimism about what we're seeing here in terms of the trends. We are seeing decline in case numbers across the state, which that is very encouraging. We're seeing plateau or flattening or some declines in hospitalizations. So those two indicators, we're seeing some encouraging signs. In the case of percent positivity, that indicator there, have more concerns about the directionality on that indicator. It is plateauing, but you can see that it's undulating up and down. Sorry, I did not simplify that for you, Mr. Skubik.
No, it's close enough.
Okay, great. Cautious optimism is what is the simplest way I would say that.
Okay, and do these numbers reflect what happened over Thanksgiving, or are we still waiting for that that data to be completed? Because the 2 weeks is up on Thursday.
Yeah, so there are some indicators that so percent positivity, one of the reasons I'm particularly interested in looking at that indicator is because that will be an early signal of what may have happened during Thanksgiving, but it's still a bit too early to understand Thanksgiving week just now.
Thank you.
All right, thank you. We're going to move on. Rod Maloney.
Yeah, hi, good morning. Just a couple of questions. How many of these types of reports have you given to us journalists? Because I don't remember any. I want to make sure I get the proper number on that. And I also want to get a feel for this information being provided to the governor, and the three metrics, and I don't mean to be repetitive, but I want to know the three metrics that the governor's office appears to be looking at that you're providing as part of what you're talking about today.
So what we've been providing on a weekly basis, Lynn, correct me if I'm off here, but I think this is the fourth week we've been providing this slide deck, or the third week. This is the second time we've provided a verbal update to you based on this slide deck. This is the information that we share with the governor, cabinet staff, legislative contingent each week. I apologize, I think I forgot the last part of your question there.
It had to do with the metrics that are most important to the governor and her staff as you look at this.
Yep. Well, I think as Director Gordon and Dr. Caldoun shared on Monday, the three metrics that we are, looking at in terms of understanding the impact of the pause to save lives, are percent positivity, the 7-day average in percent positivity, the 7-day average in cases per million people based on the onset date, and the percent of inpatient beds that are being used to treat COVID-19 patients as a 7-day average. So those are the three metrics we're looking at. I need to be really clear as an epidemiologist that there isn't one single metric that encapsulates everything about how the pandemic is responding to people's behavior, or how the disease is spreading in the community, or what that spread means in terms of our healthcare system, our public health system, and people's lives. So it's important to understand that we look at these three metrics, but as I tried to get across in this presentation, you need to understand those three metrics within a context of things like outbreaks, understanding positivity and case rate in the context of, are we testing enough people in the state? So it's a matter of having that context in order to interpret changes in those three metrics.
Okay, thank you on that one. Next, I'm going to ask that Kylie Khan, and also, I'm sorry, some of these, I don't know the names as well. I may not know your outlet, so feel free to identify who you're with as well.
Sure. Hi, I'm Kylie Khan. I'm with WILX here in Lansing. And with Christmas just about 2 weeks away, a little over 2 weeks now, are you anticipating to see another surge shortly after that?
So that is certainly the concern that public health has, and that includes, national experts in public health that have voiced this concern, as well as, people like myself. And really the challenge here is making sure that people are wearing masks, maintaining their social distancing, so that we don't see a second surge. Unfortunately with COVID-19, it's really thriving in areas where we're having close contact. And so our, contacts with family, friends, are those where we need to be very vigilant, making sure that we're still keeping a distance from people outside of our household, and wearing our masks.
Okay, thank you. Next, Catherine Wells. You want to ask your question?
Yeah, thanks, Lynn. Kate Wells with Michigan Radio NPR. Two quick questions. One thing that I'm struck by when you were showing the data about estimations of staying at home, it looks like, if I read that correctly, that we are almost to stay at home levels that we were back in the spring, really at the start of this pandemic. And I'm wondering if that's what you're seeing as well, and if you've got any thoughts on it. And then my second question is on a totally different note about schools. Obviously seeing an increase in those outbreaks. We know that high schools have been closed. There has been a lot of debate about how safe schools actually are. And I'm wondering if you can speak to, are we seeing so many outbreaks within schools because we think there's something unsafe about schools, or do we think we're seeing a lot of these outbreaks within schools because it's just easier to track that way and they're more likely to get reported?
Thank you. Those are great questions. So there are limitations certainly to this data about mobility. It's something that it's really just started to get used in terms of understanding human behavior relative to communicable disease. So I agree with you that looking at those lines, we're getting relatively close to what was recorded in the system during this time. I'm really focused on sort of what is it telling us right now as opposed to comparing in the past there. Moving on to the question about schools, I think the point that you're making about schools, the number of outbreaks in schools, what that gives us is an indication that there may be gaps in a mitigation strategy or and what is important is, not that it's indicating in some way that schools are unsafe, but that the public health system is working in terms of local public health is working with school districts. They're identifying these instances and that we are able to, improve the mitigation strategies within buildings. So I think you summarized that much more articulately than I did about how because there is a lot of attention to schools. It's a place where it is very visible if there is transmission there, and local health departments are looking very hard to identify outbreaks there. So I think it's important to understand that as we identify outbreaks, we work to mitigate the situation that caused that outbreak. So it's an important part of the public health response. I don't know if Director Gordon or Dr. Caldoun wanted to add anything to that answer there.
Not from me. Thanks, Dr. Latcott.
Thank you.
Okay. We're going to move on. Kristen Seamus.
Hi, thanks for taking my question. I wondered if you could talk a little bit about those indirect impacts of COVID-19 that you referenced, murders and domestic violence and car accidents that led to deaths. I wondered if you could sort of expand on that and help us understand the reasons why those areas might be impacted by COVID-19.
Sure. So we have this under an indirect impact section here. This is something where, obviously how we have lived our lives over the last few months has definitely changed. So I think understanding that some kinds of events may be more visible in terms of the collection of this information is important. For example, we had some discussion with the state police as they were sharing this data out with us. And one of the things that they had talked about earlier was, like, for example, the Michigan crash injuries data, that you're seeing the total number of crashes going down, but you're seeing fatalities going up. And that perhaps sort of speed may be related to that. I think there's more and more research is being conducted into the experiences that people are having while living with the pandemic, and there'll be more information coming out about this as we move forward here.
Okay. Thank you, Dr. Lankel. I'm going to see if we have time to squeeze in one more question, just because I said Graham Couch has had his hand up as well. Can you go ahead with your question?
Yeah, thanks for taking the time. I want to go back to the school part real quick. I keep hearing the idea that the science is changing, or at least the understanding of it with kids, and I'm wondering if how you feel about that, and whether the idea of kids needing to be back in school versus what we know now about school transmission, that sort of balance, where you are on that.
Sorry,
Dr. Caldoun, maybe. Oh, go ahead.
Go ahead. No, go right ahead, Dr. J.
So this is Dr. Caldoun. There's no question that education and getting our kids ideally into in-person school is a top priority. We have seen less transmission with children, but children can still be transmitters of disease. Again, we're saying that based on the outbreak data that we are seeing. So I do think that there are ways that schools can be open safely. We're looking at expanding testing. Obviously, schools can implement important mitigation measures, but we will continue to work hard to get our schools open. And quite frankly, the best thing we can do is get our community levels of this virus down so that we can get our kids back in school and open up other sectors of the economy, which I know we all want.
Are you seeing a massive difference in K through 8 versus high school kids in terms of age and whether it's puberty or whatever it is? Is any of that, is there something to that?
You know, I don't want to say exactly what it is about the age necessarily, but again, when we looked at that data, we saw that the largest group when it comes to outbreaks was in the high school group. It could be because they're gathering that age, they're a little more mobile, perhaps not just around their parents like younger kids may be. I don't want to speculate.
Okay, thank you.
Thank you all very much. I will be sending out a PDF of the presentation. It will also be posted on the webpage above the cumulative data, the dashboard, in addition to the recording to this. Thank you all very much for your participation. And if you have any follow-up questions, feel free to send me an email.